Hi, Samantha Pekh, registered psychologist. So in this video, I would like to just address some of the common concerns that a lot of parents ask me when they're first referred to me or they're calling to inquire about what treatment or therapy might look like with their child or their teen. I work with children that are about as young as 3 or 4 years of age all the way up to teen years, in addition to adult clients. But in regards specifically when somebody's calling about their child, one of the key questions that they have is, how involved am I going to be in their treatment? And what information are you going to be able to share with me? So in general, the younger that your child is, the more involved you are actually going to be. So if you're coming in with a 3 to 4 year old, there's a lot that I'm going to be working with you on how you can support your child better as a parent, depending on what it is that you're wanting to work on. And maybe very likely you're going to be in on the sessions when working with your child, so we can adjust things even as they're happening in session. And as we get to the older sort of middle child range, like the 10 to 13-year-old, somewhere in that age range, then that'll depend more on what we're working on, what the child's interests are, if we're working on individual skills, or if it's really based on things that are happening for the family and relational issues that we want to strengthen and to enhance. If I'm working with the teens, quite honestly, the teens like to have a place where they can come to, that is their space, where they can openly discuss what's happening for them and not have to worry about the embarrassment they might have by discussing this in front of their parents, worrying their parents. And then we start to figure out, how can we bring this information back to your parents in a way that you're comfortable with when you're ready with that, so that they know how they can actually support you better and meet your needs better. And I said that about the teens, but it's actually true with the little guys too. Quite often the little ones really worry about worrying their parents. And if they're able to work through what it is that's bugging them and get some answers, and they're usually more than happy to be able to bring that back to the parents and say, this is what I'm working on, this is what I've decided, and this is what I think would really help me if you did that. And going on that kind of brings me to the second question that a lot of parents have when we start to discuss what therapy might be like. And it usually arises when I start saying, well, so what are the goals? What is it that you're wanting? It's not uncommon that parents will have different goals than what their child or their teen might have. And the parents can sometimes even be surprised by what the goals of their kid would be if they're going to come into therapy. And quite often I get a lot more success when I target the goals of the child, even if it seems like it's unrelated to what the goal of the parent is. For example, to use this as an example, the parent might be coming in saying, my child is being bullied, they're having a hard time adjusting to it. I really want you to help them get past that, understand what happened, what they can do differently to help themselves and such. The child, however, I'm questioning them on what they're really struggling with and what they would like to make easier. They might say, you know what, I really miss my uncle or another family member that moved away. I used to be really close to him, and that bugs me a lot. Or I really have a hard time sleeping at night. I wake up all the time. I have scary dreams. And that might be the goal that they want to work on. And sometimes you can see the connection between what they want to work on and what the parent's goal is. And sometimes you don't always see the connection. But often if I work on the child's or the teen's goal, and that starts to actually reduce, two things tend to happen. One is that we start to see the goals of the parents sort of indirectly being addressed, because what was ever happening over here is starting to become less of a problem. Or once this is starting to get smaller, get easier, the child is happy with where things are getting at, then they're more likely and to be interested to work on the goal of the parent, which might be yelling at them all the time. Until then, the child might have no interest in trying to reduce how much they yell at the parent, just as a general example. So if you have any further questions that you would like to ask me about what therapy would look like in working with your child, what you would be involved with, and how I go about doing that, then certainly feel free to call me. If you email me, please keep the content minimal. Don't include private information. Really, email is like a postcard that anybody can read. So let's talk by phone if that's something you want to share with me, and we can see where we're going to go forward with anything or not. The contact information, my email and phone number, are listed on the website, and we'll just wait to hear from you. Take care.